Hey everyone, Dr. Mike here. Today we're diving into a critical health topic: strokes. Recognizing the warning signs early and seeking immediate medical attention is absolutely crucial for increasing the chances of a positive outcome. Time lost is brain lost, and every second counts. Now, while stroke can affect anyone, it's important to know that women may experience unique symptoms, making it even more vital for them to be aware of these specific warning signs. These symptoms can be subtle, so we're going to break down 7 of the most common ones you should never ignore. Remember, this information is for educational purposes only and is not a substitute for professional medical advice. If you suspect a stroke, call 911 immediately. One of the most telltale signs of a stroke is sudden numbness or weakness, often occurring on one side of the body. This can be a frightening experience, catching you completely off guard. Imagine this: you're going about your day, perhaps doing something as simple as making a cup of coffee, and suddenly you realize you can't lift your left arm, or your right leg feels heavy and unresponsive, as if it's made of lead. This can affect your face as well, causing one side of your mouth to droop, making it difficult to speak or smile properly. This weakness or numbness might come on suddenly, without any warning, leaving you in a state of shock and confusion, or it could develop gradually over a few minutes or hours, slowly spreading and becoming more noticeable. The key here is suddenness and the fact that it often affects just one side of the body, which is a critical indicator. This happens because a stroke disrupts blood flow to a specific part of the brain, depriving it of essential oxygen and nutrients, and since the brain controls movement and sensation on the opposite side of the body, that's where the symptoms manifest. This is why you might feel numbness or weakness on just one side. So if you or someone you're with experiences this sudden onset of numbness or weakness, don't brush it off or wait to see if it goes away. It's crucial to take it seriously and seek medical attention immediately. Every second counts in these situations. Remember, time is of the essence when it comes to stroke. Acting quickly can make all the difference in recovery and outcome. Our brains are incredible organs, responsible for countless complex functions, including our ability to think, speak, and understand language. When a stroke occurs, the disruption of blood flow to the brain can interfere with these vital cognitive processes, leading to sudden confusion, difficulty speaking, or trouble understanding what others are saying. Imagine trying to form words, but they come out jumbled or nonsensical. Or perhaps you're struggling to follow a simple conversation, feeling like you're in a fog. These are red flags that should never be ignored. Stroke can affect different areas of the brain responsible for language processing, leading to varying degrees of communication difficulties. Some individuals may experience mild word-finding problems, while others might have more severe impairments such as slurred speech or complete inability to speak. If you notice these symptoms in yourself or someone else, don't hesitate to call for help. Prompt medical attention can make a world of difference in stroke recovery. Our vision is precious, allowing us to experience the world in all its vibrancy. A stroke can threaten this vital sense, often manifesting as sudden trouble seeing in one or both eyes. This visual disturbance can take various forms, from blurry or double vision to partial or complete loss of sight. Imagine looking at a familiar object, but it appears distorted or hazy, or perhaps you experience a sudden blind spot in your field of vision, like a curtain being drawn over your eye. These visual changes can be alarming, and rightfully so. Stroke-related vision problems occur when blood flow to the areas of the brain responsible for processing visual information is compromised. This can affect one or both eyes, depending on the location and extent of the stroke. If you experience any sudden changes in your vision, don't wait to see if it improves on its own. Seek immediate medical attention to rule out a stroke and protect your precious eyesight. Our sense of balance and coordination allows us to navigate the world with ease, from walking and running to simply standing upright. When a stroke strikes, it can disrupt the intricate workings of the brain that control these movements, leading to sudden trouble walking, dizziness, loss of balance or coordination. Imagine feeling unsteady on your feet, as if the room is spinning, or experiencing a sudden wave of dizziness that makes you feel lightheaded. You might stumble or stagger when you walk, or find it difficult to coordinate simple movements. These symptoms occur because the brain regions responsible for balance, coordination, and spatial awareness are sensitive to disruptions in blood flow. A stroke can impair the communication between the brain and the muscles, leading to these disconcerting physical symptoms. If you or someone you're with experiences a sudden onset of dizziness, loss of balance, or difficulty walking, don't dismiss it as something minor. It could be a sign of a stroke, and seeking immediate medical help is crucial. We've all experienced headaches at some point in our lives, often attributing them to stress, fatigue, or even caffeine withdrawal. These common headaches, while uncomfortable, are usually manageable with rest, hydration, or over-the-counter medication. While most headaches are benign and tend to resolve on their own, a sudden, severe headache that strikes without warning, especially if it's unlike any headache you've experienced before, can be a sign of a stroke. This type of headache demands immediate attention. This type of headache, often described as a thunderclap headache due to its sudden and intense nature, can be accompanied by other stroke symptoms such as nausea, vomiting, stiff neck, or sensitivity to light and sound. These symptoms can escalate quickly, making it crucial to recognize them early. However, in some cases, the headache itself might be the only noticeable symptom. This can make it challenging to identify the underlying cause without professional medical evaluation. While the exact cause of stroke-related headaches is not fully understood, it's believed that the sudden rupture or blockage of a blood vessel in the brain can lead to a rapid increase in pressure within the skull, triggering a severe headache. This pressure can cause significant discomfort and potential damage if not treated promptly. If you experience a sudden excruciating headache that comes on without warning, especially if it's accompanied by other neurological symptoms, don't hesitate to call 911 or seek immediate medical attention. Early intervention can be life-saving and prevent further complications. While fatigue is a common complaint that can stem from various factors, such as lack of sleep, stress, or overexertion, it can also be a subtle yet significant warning sign of a stroke, especially in women. This is often overlooked because fatigue is so common. Unlike the sudden, one-sided weakness often associated with stroke, this type of fatigue tends to be more generalized, affecting the entire body. It's not just a matter of feeling tired, it's a profound sense of weakness. Imagine feeling drained of energy, as if your body is running on empty, even after a good night's sleep. This can be incredibly frustrating and debilitating. This overwhelming fatigue might make it difficult to perform everyday tasks, such as cooking, cleaning, or even getting dressed in the morning, and you might find yourself needing to rest more frequently than usual, taking breaks just to get through the day. While fatigue alone is not a definitive indicator of a stroke, it's crucial to pay attention to any sudden or unusual changes in your energy levels, especially if accompanied by other stroke symptoms, such as dizziness, headache, or vision problems. These additional symptoms can provide important clues. If you experience persistent, unexplained fatigue that comes on suddenly or worsens progressively, it's essential to consult with your healthcare provider to rule out any underlying medical conditions, including stroke. Early detection and treatment can make a significant difference. When we think of chest pain, our minds often jump to heart attack, and rightfully so. However, it's crucial to remember that chest pain can also be a symptom of stroke, particularly in women. This pain might feel like a tight band constricting the chest or a sharp stabbing sensation that takes your breath away. Shortness of breath, the feeling of not being able to get enough air, can also accompany chest pain or occur independently as a stroke symptom. This breathlessness might come on suddenly, even at rest, or it could worsen with exertion. While chest pain and shortness of breath are more commonly associated with cardiovascular events, they can also occur during a stroke, especially if the stroke affects the brainstem, which controls vital functions like breathing and heart rate. If you experience sudden chest pain or shortness of breath, don't dismiss it as heartburn or anxiety, especially if it's accompanied by other stroke symptoms. Seek immediate medical attention to rule out a stroke and receive appropriate care. So there you have it, 7 warning signs of stroke in women that you should never ignore. Remember, recognizing these symptoms early and seeking immediate medical attention can make a world of difference in stroke outcomes. Time lost is brain lost, so every second counts. Please share this vital information with your friends, family and loved ones. You never know whose life you might save by spreading awareness about stroke symptoms. And don't forget to subscribe to my channel for more informative videos on health and wellness. Stay informed, stay safe, and take care of yourselves and each other.